Folks, Nick the Nurse here. Today we're going to be talking about some of the signs and symptoms associated with the endocrine nursing problem of Addison's disease, as they might come up on nursing school exams or on the NCLEX. So let's get started. When examining a patient on nursing school exams who might have Addison's disease, these are some of the signs and symptoms that might come up. You might have darkening of the skin, okay? Hyperpigmentation. Remember that. Hyperpigmentation. Often termed a bronzing of the skin. Remember that. Hypoglycemia, hypotension, extreme weakness and fatigue, nausea, diarrhea, GI disturbances. In men, they can be impotent. They can suffer from weak pulse. In women, menstrual changes, okay? Postural hypotension, anorexia, cognitive impairment. Patient may report craving salty foods, slow, sluggish movement, weight loss, dehydration, electrolyte imbalances including hyponatremia, hypercalcemia, and hyperkalemia. A lot of signs and symptoms there. You know, when you're studying endocrine disorders for nursing school exams or reviewing them for the NCLEX to prep for the exam, there's a lot to remember. So let's kind of go through that list and go through some of the ones that are most likely to come up on nursing school exams. First and foremost, the darkening of the skin, the hyperpigmentation, very big. That bronzing, you have to know that. How do I remember that? You know, President Kennedy, John F. Kennedy, had Addison's disease. So when you think of a person who has Addison's disease, think of him as this bronzed guy, okay? He's got maybe like a bronze tan. You know, I'm sure he was tan. Think of that. That might help you remember. Hypoglycemia, that's big. Blood sugar is going to be low. That's the opposite of Cushing's. And we're not going to talk about Cushing's right now because I don't want to confuse you, but you have to know, when you see Addison's disease, the blood sugar is going to be low. You have to remember that. They also might have extreme weakness and fatigue. So patients who have Addison's can be very tired. Other big things that might come up, weight loss. Patients who have Addison's disease oftentimes will lose quite a bit of weight. You also need to know about electrolyte imbalances. When you're studying endocrine diseases, you have to know about electrolyte imbalances. The big one here is hyponatremia. And as we discussed a few minutes ago, the patient might be craving salty foods. Why? Because their sodium's low. So make sure that you know that for your nursing school exams, or if it comes up on the NCLEX, because I want you to get the question right. You're going to get the question right. Okay, remember those things. All of them can come up. They're all fair game, but the ones we kind of highlighted and discussed are a little bit more likely. You know, if I was your nursing instructor, that's what I would test you on. So keep that in mind. Anyway, my name again is Nick the Nurse. I want to thank you for watching this video today. If you'd like to check out any of my other completely free, no obligation videos, check them out. www.nickthenurse.com. Again, I'd like to thank you for watching, and I'll see you next time.